In this video, we will show you the step-by-step process of the teeth whitening treatment, also known as external bleaching. We need some essential materials for bleaching, like whitening gel, retractors, cotton rolls, and a specific light or laser. These ensure that the procedure is safe and effective. First, we prepare the patient and record the pre-operative shade of the teeth of interest. Using retractors, we separate the lips and gums so that the gel only touches the teeth. Special gingival barriers, or a dam, are used for gum protection. Now, we apply the bleaching agent, which is made of hydrogen peroxide or carbamide peroxide, to the surface of the teeth. This helps to break down the stains on the teeth. After applying the gel, we use light or laser to activate the bleaching agent. This process speeds up the effect of the gel, making whitening faster. During the procedure, we closely monitor the teeth to assess the level of whitening. If needed, the gel can be reapplied. We carefully remove the gel after 15, 20 minutes and record the post-operative shade. The teeth appear clean and significantly whiter. After whitening, the patient should be given some post-care instructions. For example, avoid dark-colored foods for a few hours and use the prescribed toothpaste. If you want to learn this technique, practice in the clinic and seek guidance from your mentors. For more detailed educational videos, don't forget to subscribe.